ಇಷ್ಟು ಯಾಕೆ ಕಾಣೋದು? ಅದು ಗೊತ್ತಾಗ್ತದೆ, ಬಟ್ ಎಷ್ಟು ಯಾಕೆ ಕಾಣೋದು ಅದರಲ್ಲಿ ಅಂತ. ತುಂಬಾ ಓಪನ್ ಆಗಿದಲ್ಲ, ತುಂಬಾ ಓಪನ್ ಆಗಿದೆ ಒಂದ್ರಲ್ಲಿ ನೋಡಿ. Yes, ji, namaste. Hello.
Good evening, ma'am.
Good evening. I'm audible, no?
Yes, ma'am.
Okay, I will start with my slide sharing. Is it visible?
Yes, ma'am.
Okay, my slide, my voice, everything is fine, visible, no?
Yes, ma'am. Yes, ma'am.
There won't be any technical problems, I hope.
Everything is fine.
Okay, I have 44 slides. By chance, if it gets delayed for 5-10 minutes, is it okay?
Yes, ma'am.
No problem, no?
No problem, ma'am.
Okay, right. When you want to start, just show me, give me
in
the
5 minutes. In 5 minutes.
Fine, fine.
Good evening and a very warm welcome to our respected guest speaker, Dr. Mamatha KV Maam, and all the delegates present here. I am Veda Chaudhary, founder of Yasharth Veda Foundation, here to fulfill the aim of Yasharth, brings you this 80th online webinar of Ayur Samarpan series on the occasion of PCOS Awareness Month. First of all, I appreciate your kind interest by joining our today's webinar and showing your constant love and support towards Yasharth, which motivates us to organize more such activities for our Ayurveda community. Now, without taking much time, I am handing over to my co-host, Dr. Harsh sir. Over to you, sir.
Good evening to one and all present here. I am Vaidya Harsh Chaudhary. First of all, I would like to thank Vaidya Yash Chaudhary sir for providing me with this opportunity to introduce our esteemed guest speaker for today, Dr. Mamatha KV Maam. Ma'am is well-known gynecologist with 30 years of experience in the subject. Ma'am is currently serving as a principal to renowned institution SDM College of Ayurveda, Udupi. Ma'am has also served as a member of syllabus committee of CCIM at various levels. Our honorable guest is awarded with gold medal in BMS from Karnataka University. Ma'am has also earned the title of Swasth Mitra by Ayurveda Vedyasan Mysore. Famous research and publication from Dr. Mamatha KV Maam includes a study on Garbhani Rasayan funded by RGUHS Bangalore and a project on PCOS. This webinar is in collaboration with our educational partner, RGC Pre-PG classes, which expertise in coaching for AIPGET, AMO, NRHM, and all other Ayurveda exams. Now, without further ado, I would like to hand over to respected Dr. Mamatha KV Maam. Over to you, ma'am.
Good evening, dear listeners. Today we are going to discuss about Asradhara, a common clinical condition which is prevalent in the gynecological practice. So most of the people in their perimenopausal age or in the adolescent age or maybe in the reproductive age at one or the other time, they suffer from this very disturbing problem of excessive vaginal bleeding during or in between the menstrual cycle. So this is a glance on the physiology of menstruation, where in the menstrual phase there will be menstruation, ovulation or the follicular phase and the luteal phase. This is how the endometrium looks, and this is what the ovarian cycle is, follicular development is taking place. So coming to the terminologies, there are much confusion sometimes in the terminologies used to describe abnormal uterine bleeding. So menorrhagia is a bleeding which is coming in regular intervals, but it is prolonged more than 7 days and more than 80 ml by definition, and the amount during this flow is excessive. Metrorrhagia is an irregular bleeding which is prolonged but may be normal in flow. The quantity amount of bleeding is normal. Whereas menometrorrhagia is irregular, prolonged with excessive bleeding. Hypomenorrhea is regular, normal, but less bleeding. Again, here it is long. Polymenorrhea is a terminology used where there will be frequent menstruations with an interval less than 21 days. So these are various terminologies which are used to describe menstrual abnormalities. Coming to the conditions presenting with excessive bleeding. So when we scan our Ayurvedic literatures, there are certain conditions wherein excessive bleeding is described with that particular heading. The major among the main heading is Asradhara, which comes in Charaka Chikitsa 30th chapter as Asradhara Nirukti. Then Raktayoni also describes excessive bleeding or the prolonged bleeding. Asraja and Apraja are the one yoni vyapat wherein there will be excessive bleeding. Because of that much bleeding, there won't be retention of pregnancy even. Then in case of Pittavrata Apana also, there is a description of excessive bleeding. Lohitakshara, there is a prolonged bleeding, description of continuous bleeding in this condition. Raktapitta is also a condition where there is excessive bleeding. In Kunapabandi and Pittaja Arthavadushti also, we get there will be excessive bleeding along with some bad odor. Coming to the definitions of these conditions, where Raktayoni says that Raktayonyakya Asrat Atisrute, excessive bleeding. Raktapitta Karairnarya Raktam Pittena Dushitam Ati Pravartate Yonyam Labde Garpe Api Sahasraja. So Raktapitta Kara Nidana is the Nidana for this condition, and the Duchana of Rakta along with Pitta is taking place. Excessive bleeding is so much so that even if there is conception, the endometrium fails to hold that conceptus, and that particular pregnancy results in abortion. That is why it is called as apraja yoni vyapat. In Pittavrata Apana, the description says that Haridra Mutra Varchastvam Tapascha Gudamedra Yoho Lingam Pittavrate Apane Rajasascha Ativartana of Rajas is seen in Pittavrata Apana. Sadaham Praksharati Asram Yasyam Sa Lohitakshara Sa Daham Ityadi Asram Artavam Sadaham Chiyate Raktam Yasyam Sa Lohitakshaya means there will be excessive prolonged bleeding, and Kshiyate Raktam, to have that Kshaya of Rakta, there should be excessive bleeding. That is why this is also included under Asradhara or excessive bleeding. Then in Rakta Pitta, though there is bleeding in through all the orifices, in Adoga Rakta Pitta, all the Adoga Margas, through all the Adoga Margas, there is bleeding, including the menstrual blood. Then in Kunapagandhi, Analpam cha Raktena. So Analpam indicates that is excessive, and there are some conditions where excessive bleeding is mentioned not as an independent vyadhi, rather it is explained as a upadrava of one main disease. So in Raktadushti, he says that in Raktadushti there will be Pradaroja. The Pradara is associated with the Raktadushti Lakshana. In Vedishonita Yatihaya, Sushruta mentioned about this. In Vandhya Harita Samhita's description, he says that there will be excessive bleeding because the Stanyavaha Srotases are blocked here. Then in Vataja, Pittaja, Kafaja and Sannipataja Yoni Vyapat, if it is not being treated in time, he says, Vatika Pradara Rupeyam, Paitika Pradara Rupeyam, Kafaja Shleshmika Pradara Rupeyam. Like in the complications, Chakrapani Datta Tika says that as a Upadrava, there can be excessive bleeding. And in the Upadrava of Vimshati Yoni Vyapat also, it is said that Pradara will be the manifestation if Yoni Vyapats are not being treated in time, or if they are ignored for a prolonged period. Then coming to the Paribhasha of Asradhara Vyadhi as such, Rajaha Pradiryate Yasmat Pradaraha Tena Sasmrata Pradiryate iti Vistarito Bhavati Asradhiryate Yasmin iti Asradhara Asradhiryate Chavate, all meaning to say that there will be excessive flow of blood in this particular condition. Right? The Nidanas, if we come across in this condition, so Nidanas, Aharaja, Viharaja Nidanas, Manasika Nidanas, and other causes, if we list out, maybe Lavana, Amla, Guru, Katu, Vidahi, Snigdha, Pishita, Gramya, Audaka, Anupamamsa, Prashara, Payasa, Dadi, Shukta, Mastu, Sura, Madhya, Kulatha, Masha, Nishpava, Tila Taila or Tila, Mulaka, Harita Ahara, Viruddha Ahara, Adhyashana, Ajirna Bhojana. These are the Aharaja Nidanas. Along with this, or interpretation of this can also be made as, because the main cause in case of Asradhara Vyadhi is Pitta, along with other associated doshas, Pittam Agnayam. So Artava is having mainly the Pitta in its dosha. So Pitta dosha increases because of all these causes. So to add on, these are the causes which are listed maybe 5,000 years ago. So today's life, if we can include many causes such as maybe eating junk food, or maybe eating the food which are contaminated with so many dushi vishas in the form of pesticides and insecticides, or maybe synthetic estrogen fortified, the chicks which are being cultivated, processed, or they are in the industry, they will be feeding these chicks with estrogen, artificial estrogen hormone to have enhanced growth. Similarly, in case of milk also, farm industry also, they treat the cows, milking cows with in estrogen hormone, which invariably comes in the milk which they give. So consumption of this kind of artificial or synthetic hormones can also be a cause of Ashraddhara. That is what sometimes we can see in the current practice. Then by any excessive indulgence in a particular rasa. For example, if a patient is taking excessive Madhura Rasa Yukta Ahara, or after taking Madhura Rasa Yukta Ahara, or Dadi Yukta Ahara, or maybe the Matsya, which is very apishandi, followed by which, if she, usually housewives, they have a tendency of having afternoon lunch and followed by they sleep for 2 hours. So this kind of patients, often we see that they come with the Ashraddhara Lakshanas, and this Ashraddhara mostly will be of Kafaja in nature. Doshaja Lakshanas, if we see or if we evaluate in those patients, we see Kafaja Ashraddhara Lakshanas. Similarly, I can remember a patient wherein she was in food industry, in bakery. She used to sit in front of fire for long period, frying the things in her husband's bakery. So that is Nitya, in say Tikshna, Ushna, exposure to Ushnata is precipitating bleeding in that particular patient. In some patients, we can also see that excessive bleeding is seen in patients where there is Ratri Jagarana, or those who are inflicted with lot of stress or associated, their lifestyle is associated with a lot of stress. So in these kind of patients, we can see Vachya Lakshanas in Ashraddhara. Or maybe in cases of patients, those who are usually primary school teachers or high school teachers who take 6 hours, 7 hours a day, continuously speaking and standing. This kind of patients also, and even traveling along with that. So what are Ashraddhara Lakshanas, we can say. See, so when assessing a patient of Ashraddhara, though these nidanas, whatever is given in the textbook, sounds little like impractical, but as you go on assessing the patients for the nidanas, what you can attribute as a cause for this Ashraddhara Lakshana, many Lakshanas and the nidanas, they start getting correlated to each other, by which your belief in Ayurveda becomes stronger. That is my experience. Hope you also come across the similar kind of experience as you mature in your profession. Then coming to Viharaja, there is the description regarding Prapatana or Atimaithuna, Atiyana, Bhara, taking the excessive weight, Divaswapna, Atikarshana, and Garbhapatana, followed by abortion. The very next cycle will be in many of the patients you can find irregular cycles and excessive bleeding in the post-abortal phase, provided there should not be excessive curettage of endometrium. Then in the Manasika Bhavas, Shoka, Santapa, and in others, there can be Abhigata also be a cause for this excessive bleeding or Ashraddhara Nidana. The Samprapti of Ashraddhara, when we understand, it sounds a very scientific description of abnormal pathology, what is seen even today in case of abnormal uterine bleeding. See, the description goes as Raktam Pramanataha Utkramya Garbhashya Gataha Siraha. So, Pramanataha Utkramana of Rakta is taking place in Garbhashya Gata Sira. So, there is excessive amount of blood present or flowing in the vessels which are forming the menstrual blood, that is, which are flowing in the uterine apparatus. Maybe you can say uterine artery congestion, and the further branches of this uterine artery, maybe the radial artery, all these will have excessive quantity of quantity of blood in all these siras. And rajovaha samashritya raktamadaya tadrajaha. So these vessels will also involve, or this excessive congestion in these vessels is in turn transmitted to the vessels which are forming the raja, which are forming the raja in the garbhashya. So rajovaha samashritya. So these siras which are the blood which is present in the garbhashya gata siraha is further transmitted to the rajovaha siras also. Yasmat vivardayati ashuhu rasabhavat vimanata. So ashu vivardhana of rakta is taking place in these vessels, and it is not doing the proper function. Rasa bhavat vimanata. Rasa has to do the prenana karma. So here this prenana karma is not being done, rather it is doing asragdara, or rather it is causing a disease called as asragdara prahuhu etat tantra visharadaha. So this is along with apanavayu dushti, agnimandya, vikrata ahara rasa. The cause for this, the dosha, why the dosha is getting prakopana, why this particular samprapti is occurring is maybe because of nidana sevana, there is dosha prakopa, agnimandya, vikrata ahara rasa, which is increasing in its pramana. Rasadhatvagni Vaishamya takes place. Vikrata Rasadhatu Utpatti Upadatu Artava also gets deranged. And Rajavaha, Siraha, Samashritya, with the Apanavata Dushti, there will be excessive and prolonged bleeding resulting in Asraddhara Vyadhi. So, Samanya Lakshana of this Asraddhara is Tadeva Atiprasangena Pravratam, Anratavapi, Asraddharam Vijaniyat, Ato Anyad Rakta Lakshanat, Asraddharo Bhavet Sarvaha, Sa Angamartha, Sa Vedana. So, the bleeding may be associated with Vedana or may not be associated with Vedana. Bleeding may be associated with body ache or may not be associated with body ache, but excessive bleeding, ati prasangena pravratam, anratavapi, it may be during Rutukala or Anrutukala, also it is present. So it includes the description of menorrhagia, metrorrhagia, and menometrorrhagia, even the menorrhea or polymenorrhagia. All the terminologies are included in this kind of description of Asraddhara. So if we have to assess clinically what are the different types of Asraddhara we come across in the clinical practice, most of the times we will not come to see the very single doshaja type of Asraddharas. Though it has not been given by some of the authors, Dvandoja Asraddhara Lakshana is not given. Depending on the association of dosha, depending on the Lakshanas of dosha, what we can see in the patients is that Dvidoshaja Lakshanas, Ekadoshaja Lakshanas have been already narrated. Dvidoshaja Lakshanas can also be attributed in the menstrual blood is the textual reference. So, what the Lakshanas are? As in any other text it is said, Alpa, Vedasta, Visa, Shabda, Fena Yukta, Krishna Aruna, Kimshakodaka Sankasha, Loha Gandhi, Fenila, Tanu Ruksha, Parusha, Pichila, Shigra, Askandi, Saruja or Niruja, Vatalakshana Yukta, Kati Vamshana Rat Parshu, Prasta, Shroni Shula, and Shita. The menstrual blood. Many patients, you can see if you are very particular in asking about leading questions in this regard, patient may say these features associated with excessive menstrual flow. So menstrual blood comes slowly, but continuously there will be a flow. And when it flows, patient feels like it is very shita. And when it falls on tiles or bathroom tiles, maybe a lot of fena gets produced when the menstrual blood mixes with water. Whereas in Pittaja Lakshana, patient says that because when the blood flows, I feel like, so there is increase in the body temperature, jwara kind of feature, or Nitanta Rakta continuous, there will be bright colored red menstrual blood is flowing. Whereas in Vataja, we have seen that it is Krishna Runa Varnayukta, Brasha Vegi in Pittaja, Nila Pitta, Sita. These are all the tinges of, many times you can see little darker shade of menstrual blood also seen. Visra, Matsyagandhi, Snigdha, Askandi, Pittarthi, Daharaga, Trishna, Moha, Jwara, and Brahma Lakshanas may be seen in many of the patients of Pittaja Asraddhara, and Ushna Strava is the feature. Whereas in Kafaja Asraddhara, you see Guru Pichila Gana Snigdha, Tantamata, and Pichilata Yukta. It is very slimy, mixed with a white discharge kind of menstruation. Chardi, Arochaka, Rallasa, Shwasa, Kasa, or a kind of guruta in the body is the lakshana seen in the Kafaja Asraddhara. Sannipataja, of course, mixed lakshanas, Durganda Yukta, Punapagandhi, Pichila Strava, Trishna, Daha, Jwara, all these rarely we come across Sannipataja. But Vata Kafaja, Vata Pittaja, or rarely sometimes Pitta Kafaja Asraddhara lakshanas. Predominantly Vata Kafaja lakshanas we see, mainly in association with the fibroid, we see Vata Kafaja lakshanas. Whereas in pelvic inflammatory disease, as a complication of pelvic inflammatory disease, when there is excessive menstrual bleeding, there you find Pittaja lakshanas. So this kind of even classifications or the correlations we have found in a particular survey, what we have conducted in 100 patients in our department. Coming to the analysis, often we talk about clots, color, odor, and volume differences in the menstrual flow. But in the modern text, we never come across the color differences, odor differences. But sometimes even the abnormal odor, abnormal color, or the volume and presence of clot is also described in the classical, in the modern literature. Clots, often they are bright red or dark red in color. Body releases the anticoagulants, which keeps the menstrual blood. Otherwise, menstrual blood, the blood, when it comes out, it gets clotted. So, to keep the menstrual blood from clotting, it produces anticoagulants. In excessive bleeding, if comes, so there will not be enough time for the anticoagulants to work on this menstrual blood. So, in these conditions, there will be more clot formation. Or if there is absence or utilization of complete fibrin and thrombin, which are responsible for the clotting, in these conditions also, we can find menstrual blood in a clotted form. The abnormal odor in the menstrual blood, according to the modern text, we see in case of vaginal infection and stagnated menstrual blood. Stagnated in the sense, if the patient is lying down for a prolonged period, or if there is any sloughing polyp, you can say infected polypoidal fibroid in the cervix, which is sloughing out. In such conditions, you can come across abnormal odor in the menstrual blood. Though modern textbook says like this, if you are keen in observing the lakshana of the patients, you can definitely come across the descriptions ranging from, I have heard one patient saying that the decaying cabbage kind of smell. Patient herself said the example that it's rotten cabbage smell. So such kind of explanations, if you are keen in listening to what patient says, it's not very rare thing to happen in the clinical practice. So wherever there is association of Pitta dosha, and in case of Pitta Nidanas predominantly done by the patient and Pitta predominant Asraddharas, definitely menstrual blood is having a strong odor, which may be little obnoxious as well. Otherwise, in case of malignant conditions, you can get the this abnormal or obnoxious odor in the menstrual blood, or menstrual blood associated with this obnoxious odor can be seen. Then abnormal color, according to modern textbooks, they say delayed expulsion due to reduced quantity, PID, uterine fibroids, cancer, cervical or endometrial cancers. The color may be abnormal. Almost sometimes black in color is also seen in these conditions, where sloughing, of course, again, and pus is mixed with the menstrual blood, or if there is excessive clotting is seen in the menstrual blood. Then number of days of all the sanitary pads, weighing sanitary pads, these are how you have to, because when you take the history of excessive bleeding, you need to be very particular about how much bleeding, because perception of the patient may be different person to person. Some patients may consider normal, like it's not the excessive, extra large pad also. Normal pad, if 3 pads, so good, because if they are habituated in their childhood or early adolescent age to have 2 normal pads. When they get to 3 pads also, they consider it to be abnormal. Or some patients, they have on light staining of the pads. They change the pad and they say they give you the count as 8 pads, 7 pads, 9 pads. You will be horrified to listen to that. Oh, 8 pads a day for 18 days. Oh, so much blood loss. So before you jump into any conclusion about the menstrual blood, just have this menstrual pictogram so that you can have an evaluation about the amount of blood flow which the patient has during the menstrual cycle. Now, pretty well, all the students or all the younger generation is using the menstrual cups, which exactly they will give you the amount of blood flow. Every cycle, they come with a description that 3 cups I changed, or this much my cup is of this size, this much menstrual blood I have thrown out this cycle. So such kind of descriptions also we come across in recent days. So depending on the tampon or feminine pads, you can have this much of this is the approximate estimation of menstrual blood loss, because based on which we can conclude what is the severity of the menstrual bleeding. Now coming to some of the causes which are very nicely classified according to the FIGO system of classification of abnormal uterine bleeding. So earlier I discussed about the Ashraddhara, that is abnormal. Broadly, I consider Ashraddhara as the description not only to a limited sense of dysfunctional uterine bleeding. Of course, there is a good discussion between the scholars of Ayurveda saying that Ashraddhara is only dysfunctional uterine bleeding. Some contradict this by saying that no, Ashraddhara is abnormal uterine bleeding. So this PALM-COEIN, polyp, adenomyosis, leiomyoma, malignancy and hyperplasia, coagulopathy, ovulatory disorders, endometrial causes of abnormal endometrium, iatrogenic causes, and some systemic and traumatic, not classified causes of excessive or abnormal uterine bleeding are classified under a keyword of PALM-COEIN. So coming to individual conditions of this PALM-COEIN, where P is standing for polyp. So in polyp, the cause of bleeding here is polyp is nothing but a pedunculated structure. Sometimes it is simple mucosal polyp, and most of the times it may be a fibroid containing polyp, a polyp which is a fibroid which develops in the submucosal or submural layer, starts protruding into the endometrial cavity or sometimes even through the cervical area as a pedunculated structure. No. So these pedunculated simple or polypoidal fibroids, they are diagnosed with only USG, or sometimes when they are visible through the cervix, you can see them through the simple perspeculaum examination also. Or you can have a better clear diagnosis while using saline infusion sonography or hysteroscopic imaging. And in all these conditions of polyp, you get increased bleeding due to increase in the endometrial surface area. The endometrium, which is otherwise flat, is now covering the excessive, the increased larger surface area over this polypoidal lesion, right? So in this condition, menorrhagia, metrorrhagia are most common due to the stromal congestion. And within the polyp, venous stasis with apical necrosis and bleeding are also seen microscopically. So in total, the cause for excessive bleeding or abnormal uterine bleeding in polyps is nothing but pramanatah raktam utkramya raktamadaya garbhashayagataha siraha prajovaha samashritya. So in total, there is again increased circulation or the increase in the congestion. It may be stromal congestion, it may be the endometrial congestion, whatever you say. There is congestion in the vessels of the endometrium. That is why the presentation of polyp is taking place in the form of excessive bleeding. Next, coming to the adenomyosis, it's not at all a clinical condition, actually clinical diagnosis, rather it's a post-hysterectomy histopathological condition. Now with the advent of ultrasonography, clinically also we will see that they declare the case as a case of adenomyosis, particularly whenever there is excessive bleeding associated with the severe pain. The severe pain is because of you can see the islands of bleeding within the myometrium. So the endometrial glands are growing inward into the myometrial layer, causing small islands of bleeding. Due to pressure of these blood collected within the myometrium, there will be severe pain. So menorrhagia here is possibly resulting from increased and abnormal vascularization of the endometrial lining. Of course, in many of the cases, there will be even thickened endometrium with the adenomyosis, and thickening of the endometrium again is raktam pramanatah utkramya garbhashedataha siraha rajovaha samashritya. So here also the pathology of Asardhara is fitting very well. Then coming to the leiomyomas, that is the fibroids, very commonly seen condition nowadays. If you scan 100 patients in their late 40s or early 50s, almost 60 to 70% of the patient you will find with the fibroid, particularly in my region. I don't know about the other places, but it's becoming very common pathology in case of gynecological practice. Here, these fibroids may be asymptomatic and sometimes, but frequently their presence is not diagnosed due to the complaint of abnormal uterine bleeding, right? So they may go asymptomatic, but when symptomatic, they are diagnosed because of the excessive bleeding. Excessive bleeding is the condition which brings them to a gynecologist. On routine examination or on a routine ultrasonography, they will be diagnosed as a case of fibroid uterus. So this is the picture of fibroid uterus where all it can be present like this. So menorrhagia here in case of leiomyomas is also due to the venous dilatation within the myometrium and the endometrium. So these are fibroids or the lesions are usually on doing the hysterectomy. By doing the hysterectomy, you can see that there will be engorged vessels to supply the blood vessels which are supplying to these fibroids or near to these fibroids will be so much engorged that the dissection becomes very difficult, or the surgical area becomes very bloody while dissecting these fibroids, or particularly while doing the myomectomy, you can come across the real problem of dissection of these fibroids due to the excessive bleeding. So here also it is the venous congestion or the venous dilatation which is giving rise to excessive bleeding. That is again Asradhara Samprapti. Malignancy and pre-malignant conditions. Here also, of course, all the malignancies are associated with abnormal sprouting of the blood vessels. So congestion is the main, even bleeds on touch, that much vascular these lesions will be. So there also there is excessive bleeding. Then in coagulopathy is a different condition. I do not, it's a condition which is similar to Rakta Pitta. So I would not say it is as an independent disease, rather it is a Upadrava. Then ovulation disorders, sorry, there is a spelling mistake. So ovulatory and anovulatory dysfunctional uterine bleeding are the two types of abnormal uterine, dysfunctional uterine bleeding here. Luteal phase insufficiency and irregular shedding of endometrium. So this irregular shedding of endometrium gives rise to metrorrhagia kind of bleeding. So there will be prolonged involution of the corpus luteum. So secretory phase endometrium continues for prolonged period because of this. So this discussion, I don't think it is valid in the discussion of Asradhara, but psychological stress, HQ axis, body weight, endocrine causes, neoplasms, PCOS, drugs, and idiopathic causes can cause anovulatory bleeding or dysfunctional uterine bleeding, the nidanas of which are very similar to Asradhara nidanas. The endometrial causes, so endometrial biopsy finding here says abnormalities in the local inflammatory response or aberrations in endometrial vasculogenesis is the cause for endometrial causes of excessive bleeding, or endometrial abnormalities or endometrial pathologies, what we come across in case of dysfunctional uterine bleeding. It may be cystic glandular hyperplasia, it may be adenomatous hyperplasia, it may be focal hyperplasia of glandular origin or adenomatous origin, or cystic glandular polyp, fibrous polyp. These are the varieties of pathologies we come across. Endometritis, metaplasia, and related changes may be there in the endometrial causes. Then the reports suggestive of underneath pathology or in dysfunctional uterine bleeding. It may be like cystic glandular hyperplasia, abortive secretions deficient for proliferation, regressive hyperplasia, adenomatous hyperplasia. Without atypia, when it is there, it is safe to treat with atypia, and with adenomatous hyperplasia with atypia, these are more prone for development into malignancy. So we need to be very careful in treating these conditions. So foam cells will be more in case of cancer of endometrium or endometrial carcinoma. Then coming to iatrogenic causes, drug-induced or some hormonal replacements or the anticoagulants like warfarin, heparin, etc. And arteriovenous malformations can cause the abnormal uterine bleeding sometimes. And myometrial hypertrophy will also be seen in this condition. Then coming to hypothyroidism, hyperthyroidism, diabetes mellitus, uncontrolled hypertension. These are the systemic causes which can give rise to abnormal uterine bleeding. And the differential diagnosis includes the systemic conditions wherein excessive bleeding will be seen in these. And the genital pathologies will include all ITs of the genital organs, benign anatomical abnormalities like adenomyosis, leiomyomata, polyps of the cervix or endometrium, pre-malignant lesions like cervical dysplasia, endometrial hyperplasia, malignant lesions, estrogen-producing ovarian tumors, testosterone producing ovarian tumors, trauma, etc. Differential diagnosis we need to consider while treating a case of excessive uterine bleeding or abnormal uterine bleeding. So when we go with the diagnostic approach, it is not with the blind Ashragdhara diagnosis we need to treat the patient. Yes, of course, the diagnosis is Ashragdhara, but what is the cause? Why this kind of abnormal uterine bleeding is taking place to the patient? So that diagnosis we need to make by diagnostic all different investigations. So diagnostic approach, we have to consider weight. When there is weight loss, sweating and palpitation, maybe it is because of hyperthyroidism. When there is weight gain, cold intolerance, constipation, hypothyroidism, miscarriage, ectopic, pregnancy, PID, trauma, sexual abuse or assault will result in pelvic pain associated with the dysfunctional uterine bleeding, whereas cervical dysplasia, endocervical polyps will often cause postcoital bleeding or irregular spotting. If the patient complains of irregular spotting, whenever straining for the motion or coughing or vomiting, there is spotting. So, or intermenstrual spotting may be associated with this kind of problems. So, in cases of jaundice, history of hepatitis and all, because of the liver involvement in clotting mechanism, then in bruises, frequent bruises, if patient is seen with, then coagulopathy should be suspected. Then pituitary adenomas also we can suspect, where there is other associated symptoms like blurring of vision, etc. If the patient is presenting with hirsutism, acne, acanthosis, obesity, etc., we can think it is because of polycystic ovarian disease. And in all majority of the polycystic ovarian disease, though amenorrhea is the presenting feature, when they start menstruating, often we come across excessive menstrual bleeding. And in cases of lean PCOD also, the very typical presenting feature is excessive bleeding, though there is no amenorrhea or though there is no prolonged amenorrhea phase or no irregularity of cycles or no hirsutism or no obesity. In lean PCOS, they commonly present with excessive menstrual bleeding. Then if the patient is presenting with the nausea, associated with nausea, urinary frequency or fatigue, etc., in a reproductive age group, in such patients, we think about pregnancy and associated like ectopic or abortion kind of complaints or the problems. Then in hypothalamic suppression lesions, galactorrhea, headache. If galactorrhea is present, headache is present, hypothalamic causes we have to think about. So then coming to the Chikitsa aspect of Asradhara. So Chikitsa Siddhanta here says that Nidana Parivarjana. That is why my initial slide was focusing much on Nidana Parivarjana. Because in most of the patients, when we see, we treat the patients with our understanding of the disease. If the patient is continuing the Nidana Sevana, then even if you treat for 3 months, the symptoms subside. After another 3 months, patient comes again with a similar complaints. Unless we identify these are the Nidanas which are subjecting or predisposing the patient for excessive uterine bleeding, and ask the patient to rectify those Nidanas wherever it is possible, it gives us permanent solution. And I would justify Nidana Parivarjana, or I can say I can give full mark those who have given this Nidana Parivarjana as half of the treatment. So unless you do the Nidana Parivarjana very specific to Asradhara Nidanas, unless you do Nidana Parivarjana, disease cannot be cured permanently. So followed by Nidana Parivarjana, if there is Bahudosha Avastha, if the Nidana Sevana is for a prolonged period, and if you need a permanent solution, or rather, if you need a quick solution for the problem, Samshodhana is the best line of treatment to start with in such patients. Maybe those who are practicing in clinics, it may be a little bit difficult. Since my practice right from beginning, I was on an academic setup. So I had all the facilities to subject the patients for whatever kind of Shodhana I wanted. So that is why I could reap good results of this Samshodhana in the patients of Asradhara. Then the Samshamana Chikitsa and the Rasayana Chikitsa. The Asradhara Chikitsa never ends without Rasayana Chikitsa. So in Samshodhana, again, we have discussed about the different kinds of Asradhara or different types of Asradhara. So in the different types of Asradhara, we need to consider the Prakriti and the Vikriti of the patient. So Vata Prakriti patient, if Vata dominant, maybe you have to go for Vasta Chikitsa or a Mradu Virachana or a Sneha Virachana in those patients. Whereas a patient of Kapha Prakriti or Vata Kapha Prakriti with the Kaphakara Nidanas, with the Santarpana Nidanas, with polycystic ovarian disease, maybe with the fibroid also sometimes, a well-built patient, Vamana is the ideal line of treatment, what I have seen in my patients. Then Nasya, I have not practiced Nasya to a major extent, but in acute bleeding, sometimes I have given Durva Grata Nasya, Durva Taila Nasya, Durva Swarasa Nasya as well. To some extent, I cannot very specifically say this Nasya alone worked in these patients. I clubbed it with many other modes of treatment. That is why it worked. I would say as an adjuvant treatment, maybe this kind of Nasya can be given. Otherwise, Nasya alone, I don't have much experience on giving Nasya alone as a treatment modality, Shodhana Chikitsa in case of Asradhara. So in coming to Virechana, since it is this Vamana is Pratimarga Haranam cha Raktapittam Vidhiyate, Raktapitta Vidhiyate. So Pratimarga Harana in case of acute bleeding phase of the patient, if the patient is having prolonged bleeding for 15 days, 20 days, if her Bala is very good, if she is still, the hemoglobin level is very good, if she can sustain this Sadhya Vamana process, even you can opt for Sadhya Vamana to stop the bleeding. Many patients respond very well to this Sadhya Vamana, or if there is time, even you can think of Arohana Snehapana Yukta Vamana. So depending on the disease, you have to select the Sneha for Snehapana and you have to give the Vamana Chikitsa. And Vamana, definitely in the next cycle of Vamana, you can observe in the patients the clots in the menstrual blood will reduce very significantly. Pichilata in the menstrual flow, Tantumata in the menstrual flow will be very much reducing in case of Vata Kapha Asraddhara by adopting the Swamana as a Shodhana Chikitsa. Virechana, if we take it as the dosha which is predominantly involved, so without Pitta involvement, Asraddhara cannot happen is the text. What text says. So Virechana is any condition of Asraddhara provided in acute phase. I do not prefer giving Virechana. As I give Vamana, Sadhya Vamana, in case of excessive bleeding, I have not given Virechana in case of excessive bleeding during the phase of bleeding. Maybe it's a Adho Marga Pravrakti is becoming, because Anulomana, with Anulomana, even the bleeding may get increased. That is my fear. Maybe I'm wrong also, but I have never tried giving Virechana or Sadhya Virechana in a patient who is already bleeding. But in the interval period of bleeding, if you give, most often I prefer giving Arohana Snehapana Yukta Virechana, not a Virechana or not a Sadhya Virechana. So Virechana is, I can say, giving very good results in case of such bleeding. One more thing I want to highlight here is in case of hyperplasias or lesions, space occupying lesions, or in case of endometrial, even endometrial hyperplasia also, this Shodhana therapy works very well. Maybe Vamana alone or along with Vamana and Virechana. Even the endometrial hyperplasias, even up to 18, 20 mm, 22 mm, 24 mm, which have been otherwise posted for endometrial, posted for hysterectomy. Of course, you have to go for an endometrial biopsy to rule out the malignancy in these conditions. After ruling out the malignancy in the endometrial hyperplasia, if you go for Samshodhana Chikitsa, I bet you will get a very good result. So, Shodhana Chikitsa is part and parcel of Asraddhara, which is of chronic origin. Here, if I have to quote, I remember a patient who is around 38, 37, 38 years. Right from her 27, 20 years, 28 years, she was having very severe, very excessive menstrual bleeding. She took so many medications, all pathies she consulted. Then she underwent insertion of Mirena when she was around 33 years old. So for 5 long years, she kept Mirena. Of course, she had lot of complaints like mood swings, all these, whatever happens with the Mirena she was not, and even the recurrent vaginitis, irritation of the thread, so many complaints. In spite of that, fearful of getting the hysterectomy done, she continued to keep Mirena in situ. At 37 years, 38 years, she got her Mirena removed because already 12 years span of that Mirena was over. Then again 3 months, she saw it was moderate. After 2 months, it became, first month it was normal, little normal. Second month, it became little excessive. Third month onwards, her bleeding was as before, very much excessive, lasting for 8, 9, 10 days with 8, 7, 8, 9 pads a day. That heavy bleeding she had. So reluctant to get admitted, she was on oral medication for 2-3 months. Of course, there were some difference, but her Nidana also, she's not that obedient patient. So because of that Nidana, somewhat she compromised, though we have given her strict rules. She was not adhering to the Nidana Parivarjana very strictly, but she had little bleeding, excessive bleeding only. Then ultimately, after repeatedly telling her about the Shodhana Chikitsa, she got admitted. All Shodhanas, Vamana, Virechana and Basti, she underwent. So the 4th cycle onwards, first Vamana, after Vamana, she found a good result. Virechana just increased her belief. And after the 3rd setting of treatment, she was very happy. And now without Mirena, without hysterectomy, she is having her regular and normal cycles, which was there, which was bothering her for almost 10 long years. So that is the wonderful result of this Shodhana Chikitsa in case of Asraddhara. So if you ask me for Astapana and Basti, what kind of Bastis I use? I go for, mostly I go for, in case of excessive bleeding, Mustadi Apana Basti is my preferred Basti here. Of course, Lodhradi Astapana of Sushita, Kushadi Astapana, Rasnari Niruha Basti is also we give here and there. And Picha Basti, that is the best Basti which gives results in case of any excessive bleeding. Of course, in patients, those who are having irritable bowel syndrome associated with Asraddhara, Granimula diseases also, this Picha-Basti gives very good results. Then coming to the Anuvasana drug, whatever we use for Anuvasana Basti, either if it is an anovulatory bleeding, we use Shatapushpa Taila, Madhuka Anuvasana Basti, Madhuka Taila, or Madhukoshikadi. This I have rarely used Madhukoshikadi, rather Durva Taila, Drakshadigrata, and Nalpama Radhi Taila. Though it is not mentioned here, I forgot to write here. Then simple Dhanvantari Taila. In case of excessive bleeding, even Vata predominant cases, pain predominant cases, Mahanarayana Taila. So all these are the drugs which we use in case of Basti, for Basti. In Kapha Pittacha Ekamolika drugs, if we are thinking of Durva, Chandana, Ashoka, Vasa, Lajjalu, and Udumbara, can be the Ekamolika Prayogas. But mostly these are useful Ekamolika Prayogas maybe in adolescent dysfunctional uterine bleeding only. So in the adolescent girls where the excessive bleeding is there, then we can do this Ekamolika, because those young 11, 12, 13, 14-year girls, so we cannot call them even for Shodhana. So in such patients, we can think of Traksha, Shalmali, Shatavari. So Kumari, I don't use much, but here it is mentioned. Amla Dadima and Pipali, Dadima, Guduchi, and Shatavari, and those akshanas, but very rarely found with. The Kashayas, what I use my in practice is Musali Kadiradi, Vasa, Guducheri, Panchalkala, Chandanari Kashaya, Sukumara Kashaya, Gandharvastadi, and Gugulatika Kashayas. Then Rasaushadis, Pradharari, Pradharipu, Bola. Bola Bhadarasa is a very good combination which can be very confidently used. Bola Parapati is also a good drug. Chandrakala and Pradharantakaloha also I use in my practice. Pradharari and Pradharipu I very beginning I used, but I don't have very good result. I did not come across very good results, but last 4 or 5 drugs, yes, they are very good. Then coming to Grata, even I tried Vasagrata, Shatavari Grata, Tiktaka Grata, Mahatiktaka Grata, Shitakalyanaka Grata, Shatavari Grata, Putaja Kashmari Adigrata, and Kashmari Adigrata. All the drugs work wonders, but provided you have to have little insight about what is the dosha involved in these conditions, then only you can have a better selection of these gratas. These gratas may be used as the Shamana gratas as well as Gratapana for Shodhana. So both ways you can use these gratas. Putraja Kashmiri Grata is having very good results in these conditions. Even I use it for Pana or even for Basti. Then coming to Asavarishta, in the adolescent dysfunctional uterine bleeding, Ashoka Arishta or the Ashoka preparations are very good. Patranga is associated with anti-inflammatory properties, so there we can use Patranga. Draksha in Pitaja, Asraddhara, Chandana, Ushira, all in Pitaja Lakshanas. Ashwagandha Arishta in Bala, like Vataja, Lodrasava, and Lodrasava in case of Vatapittaja. Even Vata Kaphaja also you can use Lodhrasava. Even it is a regulator of menstrual cycle. So if the cycles are irregular, then also you can use Lodhrasava. Lohasava, not during the cycle period, but in the interval period, in case of Kapha patients, we can go for Lohasava. Then in the churnas, we can make a single churna or a combination of the churnas, and we can practice Pushyanuga, Nagakeshara, Lodhra churna, Amalaki churna, Chandana, Estimadu. Even we can mix them with some of the Rasaushadis like Godanti Basma or Pravala Pishti of inflammatory origin if it is there, Rajata Basma, Vanga Basma. can also be mixed with these powder combinations. Balamula, Shatavari Kshirapaka, Ashokatva Kshirapakas are the varieties of even Audumbara Phala or Audumbara Tvak Kshirapaka, or sometimes Audumbara Jala can also be given in the patients of Asratara for Bala. And I discussed in the beginning only that Rasayana, without Rasayanas, this treatment is incomplete. So Kushmanda is the drug of choice in case of Asratara, and Draksha Avaleha, even Narasimha Rasayana, Kotacha Avaleha, Vasa Avaleha, Prayat Vasa Avaleha, these are the good Rasayanas as well as the Shamana Aushadis in case of Asratara. For the Basti, it's not for Panartha, Hingutrivanataila in case of Vata Kafacha or polycystic ovarian disease condition, Estimadutaila in case of Pitta predominant, Dhanvantara in case of Vata Pitta, Balagudichadi in Pitta, Durvadi in Pitta. You can give it as Anuvasana Basti along with any other combinations. So this is individual chikitsa of different univyapats. Everywhere Raktastapanam Aushadam, Raktastapanam Aushadam, Yatha Dosham Raktastapanam Aushadam, Yatha Dosham Raktastapanam Aushadam. So wherever dosha involvement is there, by seeing that, you have to give the chikitsa. Rakta Pitta Haram here, Adava Rakta Pitta chikitsa in Rakta Pitta. So this kind of Chandana Kvata in case of Kunapagandhi chikitsa. So this is the line of management. In treating Asraddhara, we come across two types of approaches. One is Vyadhi Pratyanika Chikitsa and another is Dosha Pratyanika Chikitsa. So if you are choosing Dosha Pratyanika Chikitsa, probably these are the set of medicines what you can think of. If you are like grossly going without any fineness in it, Vyadhi Pratyanika, you don't have time, you don't have patience to evaluate, then these drugs are Vyadhi Pratyanika. Any cases you give these drugs, they will give you the results. Here, when you give, I can quote you a case. There was a patient of excessive bleeding. It was in my beginning days of career. So I started since Panchavalkala is a Stambhana Aushadhi. I gave her Panchavalkala. Even after 5-6 hours of 5-6 doses of Panchavalkala in the ward, I could not get the result. It was a Vata Kapha patient, very Vata Kapha Asraddhara. I gave her one shot of Vasasuraza. I got the result. So it is Kapha, Vata Kapha, Vasa, though it is Raktapitagna drug, I don't know. Vasasurasa works very well in the patients where there is Vata Kapha Asraddhara, whereas Panchavalkala works very well in case of Pitta associated. Right? So according to dosha, you can select the drugs as a dosha pratyanika chikitsa in these patients. So I think another 5 minutes I will reserve for question and answer. And I thank the organizers for giving me an opportunity to share my views with you, my experiences with you. And I thank the audience for your patience listening. Thank you.
On behalf of our Yasharth family and all the participants, I would like to thank you, ma'am, for your valuable time. Your insight was truly valuable and left a lasting impact. Thanks a lot, ma'am.
Thank you. Should I wait for the questions or I can quit? Should I wait or I can quit?
We should end it now.
Pardon?
We should end it now.
Yeah, fine. Thank you.
Thank you, ma'am.